Okay, welcome to Matt Plays Games You've Never Heard of and Don't Care About. This week's edition is Big Pharma. It's part of the weekly bundle on Humble Bundle. For $15 you can get this and some other games, Frozen Synapse, Frozen, the other one, some stuff I don't remember. You can also check out the Ubisoft Humble Bundle, which is getting more and more stuff added all the time, most notably Assassin's Creed Rogue and the other thing, The Crew. And then you can also get a pre-order for $75 for The Division, and it comes with a t-shirt and a coupon for 66% off of 3 Ubisoft titles. There's an asterisk there saying some of the better ones, the ones you would actually want, the coupon does not apply for. So I'm not sure that specifically then what those coupons are good for. You can kind of look into that for yourself. I'm going to go ahead and get started with this game. This is my 4th attempt at recording a Let's Play, so that's the only experience I've had with this game. I've played it maybe an hour and a half now, and I've not been able to make a profitable drug. So let's see if I can turn it all around this time and get something going that's actually going to be profitable. My guess is that I won't be able to at all, but I'm excited. I think I'm making progress every time. I'm picking a really ambitious goal, though, which is to make $2.5 million. I don't think you'll see me accomplish it in this Let's Play. What the game's all about anyway. Alright, like I said, show me the money, intermediate scenario. Slightly reduced research and cure trees. Settings are tweaked to make for a slightly easier game. So it's not advanced, but it's not easy, I think is what they're trying to say there. I'm going to do Matco Pharmaceutical. Okay, cool. I can work with this, kind of. I think any of these things are the same thing. Maybe I'm just... Can you even rotate the camera? No. I think these are all the same idea. Let's see what my ingredients are. It says step 1. Okay. Yeah, neither one of those is really great. I'm going to go with calms acid reflux. I think that's the way to go. I need to hire a couple of these right now. I'll tell you that. Okay, we're just going to pump out acid reflux medication, and it looks like we're going to have to increase. Oh. Well, that's helpful. You upgrade with that with this thing and reduce it with that thing. Okay. So I'm going to get a scientist working on that then. And let's start by get the party started by just running it through that thing. Nice and simple. Easiest thing we can do here. Import this biodegradable Pengsat tincture. I think it's the fancy way of pronouncing that. Okay. Hey, it's not fancy, but it works. And it's profitable. Ooh, except it won't be. Wow, okay. Well, that's a pretty big oversight already. I don't think it's going to accept that. Yep, that's what I thought. Okay, so already messed up. Turns out you have to turn this into something. You have to actually make a product with it. So I think the only way it's going to let me do anything with that either is for me to erase it and redo it, at least as best I can tell. So it's a waste of another $100 there, which, you know, pharmaceutical companies.
Product name required.
Let's see if I can turn a profit on this guy. The Acid Punisher.
A competitor has released a new product.
Acilex. That's what I'm calling it. Okay. Let's reduce our ingredient costs on this guy.
A competitor has released a new product.
Okay, pretty close to getting the agglomerator. Agglomerator? I don't know. Whatever.
Research complete. A competitor has released a new product.
Please tell me we're about done with this. Nice. Just finished. Alright, let's figure out a new way to do some business here. Well, I'll make her... Okay, that's going to be a workable system. Let's see what our new product looks like. Keep our scientist right where he is. See if we can turn this into some profitability here. Yeah, look at that. Calms fast reflux and does not cause fatigue.
Product name required.
Acid blocks 8,000. Oh, that's brilliant. Alright, cool. Pretty soon here we're going to be showing some profits. I can feel it. Except realistically...
A competitor has released a new product.
Let's see about making a new product line on this side of the factory too, though. Something better than this guy. Okay, cannot remove upgrade with this thing. It's really not worth it though. Alright. Cool. Let's do that. That'll reduce our cost. Oh, pre-requirement is 16 to 18. Well, that's interesting. So do I need to run that through two of those things? I don't know, enough floor space. Sometimes they give you really big, areas of the factory. Sometimes they don't. It's definitely better to start in a room like that guy or this one. There's a lot of things that can really kind of mess you up in this game. That'll give me $3 extra per pill. Okay. Yeah, that's seemingly worth it. Any new ingredients yet? Oh, very close. Very, very close. Please be something amazing. Alright, you're both fired. So I need to try and post a profit here for a second. Hey, we posted a profit literally for a second.
A competitor has released a new product.
costs way too much. That would not be profitable. Okay, so, I mean, I'm barely not posting a profit, I guess. Still have the scientist, right?
New world event.
So what happens if I
A
fire this
competitor has released a new product.
I'm making money, I think, yeah. Okay. I'm bouncing back and forth, but I'm still making money.
A competitor has released a new product. Insufficient funds. A competitor
It's
has
$3,000
released a
to
new
hire one,
product.
and then you have to pay him on top of that. Okay. Are there any acceptable loan terms? Not really. Alright, well, I mean, it's sustainable. I could just sit here
A
and make
competitor has released
a
a
small
new
amount of
product.
money forever. I really don't know what to do. What is this whole cures thing about?
A competitor has released a new product.
Okay. So... What?
A competitor has released a new product. A competitor has released a new product.
So that... What? So this thing does the same at a lower range. It actually alleviates stomach ulcers, which is a lot more profitable. And I think more in
A
demand.
competitor has released a new product.
An antihistamine would be nice, seemingly.
New world event.
Antibiotic. That would be great. What some of these things over here do? Decimates concentration. Or, oh, for concentration between 1 and 10, increases concentration by 10. Concentration between 11 and 20 decreases concentration by 10. Doubles concentration, halves concentration. A sachet fabricator.
A competitor has completed a new
Syringe
patent.
injector, creamer.
A competitor has released a new product.
I need a creamer, man. How do I get a creamer? I'm very far away from having one. Alright, let's hire one of these guys for a little while at least.
A competitor has released a new product.
Look at this bar up here. That's ridiculous. Is there any way after a while I can get rid of this without going into and looking at every single one of these? Yep, totally care. Boo, boo, boo. I care. Okay, cool. Yeah, let's just make our product more profitable. Allow us to actually pay for our scientists for a little bit longer. An evaporator too, right? Yeah. Okay. Let's hire another scientist, really get this thing moving. Already paid back that loan, right? Yep. Alright, I don't think... Did we ever take it? I didn't take any loan, that's right.
A competitor has completed a new patent.
Okay, you're both fired. Jeez.
A competitor has released a new product. A competitor has released a new product.
There's got to be something about this game that I'm missing. Like, I need to get through these trees and actually make some physiological, or psychological rather, drugs. Sexual health removes warts. Yeah, that would be good. Painkillers. That's where the money's really at. Need to get painkillers.
A competitor has released a new product.
The company that keeps
a competitor has released a new product.
Reflux, Prilosec, I guess. Must be that company forever. Well, if we've learned anything, it's that I'm not very good at this game, and there's definitely some nuances to it that I don't understand. But it does seem pretty cool. I've enjoyed playing it, despite what it might look like. This is a good time.
New world event.
It just seems like it's so random. Everything you start with is very random. This little small room I'm working in, the ingredients that I start out with, I mean, it's all completely random.
A competitor has released a new product.
It's just like this is very difficult. Need to be making a bigger profit than $7 and $41, and it's become very difficult. Even with me trying to reduce the costs of these things I'm working with.
A competitor has released a new product.
Probably go back and start playing this game as a beginner and enjoy it a little bit more. But at intermediate, it's definitely a very difficult game. At least with a very minimal understanding that I have of it right now. But check it out for yourself. Like I say, it's on the weekly bundle. Yeah. Okay, I'm going to give you some closing thoughts here, and I think that's going to do it for us real quick. So that was Big Pharma, and that's how you don't play it very well. I wish I knew more about this game. I'm going to be spending more time playing it, I think, if I can have that opportunity. We've been working really hard on getting egplays.tv in a place where it looks where we want it to, and it operates in that way. Also been putting out more episodes of Enlightened Gamer podcast, so check that out. And if you already listen to us, it'd be really great if you give us a review on iTunes. That'll help us push our way to the top and get some better exposure, which should just be helpful and nice for us, but we do appreciate your listening to the podcast already. You can follow us on Twitter, which we're trying to be more present on, at VideoGamePod. Yeah, I think that's going to do it. Thanks for joining me on this one. I hope it's been enlightening. I'll see you soon.